This is Melissa Cleater with the National Fund. We are going to go ahead and get started. Thank you so much for joining us today for our fourth webinar in the webinar series on job quality, COVID recovery, and racial equity. And this one in particular is around finding and securing grant funds to support workforce development and COVID recovery. So I'm going to go through just a little bit of housekeeping first, if I could have the next slide. So if you are somebody who uses a computer and a phone, and your computer automatically connected you to computer audio, we're going to ask you to disconnect your audio so that we don't get any of that nasty feedback. This slide here shows you how you're able to go to that caret at the bottom and select to disconnect your audio. And then next slide, you'll also want to pair your phone with your computer. And the way that you do that is once you leave the computer audio, it gives you an option here to join audio. You'll want to select from phone. It gives you some phone numbers there and your participant ID. The participant ID you'll want to enter when you call in, and then that will connect both your phone and your video. So moving on from there, first, again, let me just say thank you and welcome to joining us. I would love for everybody just to go to the chat and type your name, your organization, and where you're calling in from. That's a great way for us to get a sense of who's joining us on the call today. So use the chat function there. And then this is a high-level overview of what we're going to cover today, but really we're here today to talk about money. You know, we all know that the healthcare sector is struggling financially from both COVID and the economic downturn that is related to that. And we also know that when budgets tighten, workforce development is often on the chopping block. And so that's going to require workforce development practitioners, whether that is somebody working within a healthcare organization or a partner organization, to really be resourceful and strategic around finding those funds to continue the really important work to invest in the skills and careers of our frontline workers. So next, we have next slide, please. We have a really fantastic panel with us today. We're going to start off hearing from Andrea Kipper, who's the development director here at the National Fund, and she will give us some insight to the funding landscape in response to COVID-19, as well as some helpful tips. And then we're going to hear from some folks representing two healthcare organizations. We are going to hear from Chris McCarthy and Aaron Wett from Unity Point in Des Moines, and from Shannon Joseph with Asha Health in New Orleans, and they're going to share their experience with finding and securing grants during this tumultuous time. Of course, as always, we really encourage engagement from you all throughout this presentation and throughout the webinar. So if you have questions that come up, please enter them in the Q&A function. So if you look at the bottom of your screen, you will see that there is a chat, and then there is also a Q&A. Put your questions in the Q&A, but in the chat, I also encourage you, if you have a +1 color commentary or something to add to the conversation that's happening, please do that as well, because we love the engagement. So without further ado, I am going to turn it over to my colleague, Andrea.
Hi, everybody. Good afternoon. Next slide, please. So I'm going to talk about a couple of pieces in overall funding, and then the other speakers are going to dig into some more specifics that might be relevant for you and your organizations. I want to talk a little bit about funding cycles, specifically the disaster cycle. I know it seems like we've been in the midst of the disaster, and it's bizarre to think we're in the middle of a recovery when it looks like another wave is coming with coronavirus. So I want to talk a little bit about what it's like to fundraise during that, how to engage your funders, because believe it or not, right now really is the time to implement some best practices. I want to talk a little bit about CARES restrictions, grant management, things like that, just not to overlook during this time, because this could be a potential challenge once the CARES money runs out. And then thinking also about how to be innovative and support sustainability. One bullet in here that I didn't put in, and actually you can go to the next slide, are some examples of where to locate grants. There are dozens and dozens of resources. These have been really tried and true for myself for a variety of things. First of all, they list active RFPs. You can narrow down your search by industry, by region, by type of funder. Most of them have free services. I know a few of them, like Foundation Directory Online, offers free services of their entire catalog if you're in a public library. So I don't know if they've modified it because of COVID, or if your libraries are open in that way, that they have spaces where you can access their full portfolio there. The Chronicle of Philanthropy and Inside Philanthropy really offer robust news sources and lists of active RFPs and grants that you might have access to. And then another on here that I didn't write is I really encourage you to get on the listserv for your local mayor's office or city council's office. I know in Washington, D.C., where the National Fund is based, the mayor actually releases a weekly announcement for grant opportunities. They can be small. They can be as small as $1,000, but I've also seen a few for a couple $100,000, and they have a wide variety of topics. So I really encourage you to get on those listservs and get in the habit of reading these emails. I know that there's a lot of email piling up, especially with everything being remote, but I have found that these resources have been really tried and true. They all also offer free training. Candid offers plenty of free online training on different skill sets, from grant writing to prospecting to staying in touch with donors to even virtual event planning. So I really, really encourage you to take advantage of these. And I believe we'll be sending out this list at the end. I can send it out at the end of this meeting as well. Next slide. So it's bizarre to think that we're in the middle of a disaster while unfortunately other disasters are happening. I live in Denver right now, and there's a fire that just broke out 30 minutes north of here. So if you hear me coughing uncontrollably, that's actually probably why. And so when thinking though in the context of the coronavirus, you as healthcare organizations want to situate yourself within the disaster cycle. And there's 4 phases. So there's the preparation phase, and then there's the response. And between the preparation and response, you see that there's the event. Again, what's challenging about COVID is it sort of feels like we're still in the midst of the event, but we're still also responding and recovering. And then finally, after recovery, you have mitigation. And so this catalyst moment, the event, is really where it's important for you as organizations to think through, how is this crisis impacting your work? What did you have planned that has to be put on the wayside because of the crisis? And what do you need from your funders to do the work to address the crisis? So if it is workforce development programming to ensure that you maintain staffing, to ensure that you're able to hire again once your hiring freezes are lifted, or once you're able to do elective procedures, those are all critical to respond to the crisis. And then one thing I really would urge you to consider is, are normal fundraising activities that you can put, are there normal activities you can put on hold? I think this is a very controversial opinion. I think fundraising events should just be forgotten for the next 12 months, because I think it's an unfair burden on development and fundraising staff to plan virtual events in the midst of all of this. But if you can't necessarily cancel it, maybe think about how can you pivot it to a lower lift? How can you have your board or constituents help you plan something that's a little lower lift for you? Because again, we're not really operating business as usual, particularly because of this specific disaster. And I think just something to look at, like, is it bringing you money? Is it bringing you resources? And if it's not, let's put it on hold. But really thinking about, how can your expertise as this organization, how can your workforce development programs help you respond to this crisis and help recover from it? And if you frame it that way, it's going to be a much more compelling argument when you're writing grants, when you're working on proposals, or directly with funders. If anyone has any questions or comments, I'll do my best to manage the chat as well, but please chime in. And Josh, do you mind doing the next slide? So I mentioned this earlier, now is really the time to engage your funders. I know that it's overwhelming when there's a lot going on and it's easy to get caught up in what's going on in the day-to-day, but there are really good best practices that I would encourage you. And if they're not part of your regular fundraising routine, bringing them in. So number one is creating consistent touch points. It doesn't have to be an hour phone call with every funder every month. It can be an email forward and saying, hey, I saw this article and thought of you. Hey, did you see this news story about our organization this month? Wanted to send it your way. Hey, we just reopened our doors for the first time in 3 months doing this program. I wanted to let you know. Just small, consistent touch points. Even something as simple as just a check-in email. You know, I have found that my funders and I have gotten a lot closer these last 7 or 8 months because I think there's a real human element of what's going on. Like they're experiencing the crisis too, checking in and seeing how they're doing. Number two are acknowledgement. So if you're getting an increase in gifts, if you're getting gifts at all for your programs, making sure you're doing written acknowledgments. An email is totally fine right now because very few people are in their offices consistently. But I really recommend some sort of touch point to thank them. And then finally, utilizing your board. Is there a list of folks that you can have your board reach out to thank them for their support? Can your chairperson give them a call, see how they're doing, see what their priorities are? Chairperson to chairperson is usually a pretty good level. And so I'd really recommend thinking through how you can use your board at this time. It's not just you. And then when you talk to your funders, really telling them what you need, whether that's capacity building for those fully remote trainings, whether you need to revise current grants that you guys are in the middle of, whether you need to totally pivot. You know, I encourage you to have these honest, thoughtful conversations with your funders and keep them in the loop, because there's nothing worse than the week of final report is due and you have to submit all these budget modifications and the scope of work changes, and your funder feels like, why wasn't I kept in the loop this whole time? So I really encourage you to harness some of those best practices of finding consistent touch points. The holiday season is coming up. Creating an e-card to forward to your 10 or 20 most loyal funders is something that doesn't take a lot of time, but really can have a big impact. I don't recommend handwriting things because we don't know where people are right now, and I would hate for you to waste that time and energy. Next slide, please. So this is one that I learned a lot. We learned a lot on the job with the CARES Act. The National Fund was a recipient of one of the loans, and I think we've learned a lot about management for that funding. So when thinking though about grant management under the CARES Act, if you've received some money from the government, from the federal government or state government or even local municipalities, is that money impacting your budgets of other grants that are currently underway? So did you get funding that was technically already covered by another funder? And that's something you really need to look at early, because if you receive that money and it's offsetting money that was already pledged, you need to talk to your funder immediately to try and get that money moved around, whether you want to do a no-cost extension, whether you want to put that money towards training programs that maybe are being cut right away. So just really taking the time to look at those budgets now. I know that it can seem a little daunting, but my experience with funders is like they've been really receptive to changes. They're open to budget modifications. They're also so incredibly busy themselves and they are experiencing the rapid change from day to day that they also are being faced with these budget modifications of their own at their own organization. So utilizing those really good relationships and best practices to stay in touch and have open and honest conversations about how potentially federal or state or local money could have impacted your program budget. And I think this last question of how do you talk to your funders about likely changes, you should be having regular touch points with your most loyal funders, particularly the ones where you have open grant opportunities or you're in the middle of a grant with them. Nothing should be a surprise to them when you pick up the phone to call them if there is a change. So I would really encourage you to take stock and have those conversations now, particularly if another wave of coronavirus relief funding comes out. Next slide. Sustainability planning. So, I am a fundraising officer. The dreaded question is, at the end of the proposal, you write this beautiful proposal, you have a great conversation with one of your donors, and they ask, like, how are you going to sustain this after our gift ends? And you've put all this time and effort to building this new program, to coming up with this new idea. And it's like, I just gave you this idea. I really have to tell you how it's going to work in another couple of years. But this is really, really, really critical for funders to know that their impact is going to go farther. They don't want to be just a one-off project. They want to see how their gift is going to be built into your organization's future. So one of the things that I recommend, there's sort of two realms for sustainability. There's financial sustainability for the organization and program sustainability. So when thinking about financial sustainability for the organization, I really recommend building in general operating funds into every grant. So this is different than the indirect cost formula, which your organization probably has one set, or you have to follow the one based on what the funder is telling you it has to be. I really encourage you to write into every grant 5, 6, 7% of the budget is going to general operations. You have to be prepared for your funder to come back and say, I don't want to do that, which has happened to me a few times, but there have been instances where they actually are coming back and supporting this money. And that can really be used to do these programs that unfortunately are getting cut. And then, another piece, and I'll kind of move quickly, is we want to make sure that the funders really want to make sure that entire positions aren't funded by just one grant. So if you can pool grants across the same program so that you're spreading out that income. And then finally thinking about, building that loyal base of funders and making sure you have those big touch points. And, creating funding and co-investing into all of your work. So if there's a match element, try and work that in as well. Those are some of the big tips for sustainability. I believe my information is in this event, or you can reach out to me directly if you want to talk a little bit more about that. And I think that's it for me.
Yes, thank you, Andrea. So if we could go to the next slide, we will move over into the peer sharing portion of this webinar. That is always a big cornerstone of the CareerSTAT network and the things that we do here. So I am going to turn it over to Chris so you can tell us what's happening in Des Moines.
Good morning. Thanks for having us. My name is Chris McCarthy, and I'm a Community Health Project Manager at Unity Point Health. And I'll let my colleague Erin introduce herself, and I think she's going to kind of kick us off, and we'll take you through a little bit of what we're doing in Des Moines to really try to respond to COVID and utilize funds from the community and other partners in a mindful way.
Hi everyone, I'm Erin Went and work with Chris McCarthy and a few others on the call here today. If you want to go to the next slide. Just a little bit about Unity Point Health Des Moines. We are located in central Iowa. Currently, we are a 5-hospital system. We also have a cancer center, community-based mental health, home care, and clinics. We do have 6 rural community access hospitals that are partners with us. And our central Iowa team is about 8,000 employees, 6,000 of those full-time. And our mission overall is to improve the health of the communities we serve. We are part of the broader Unity Point Health family, and that organization has 32,000 employees, and we're across 3 states. So that gives you a little context of what we do and our size. So next slide, and Chris will talk next.
Thanks. So one of the things I want to share with you is a very specific project that we've got in the works and are kind of not wrapping up, but still moving forward. It's a one-off type of event. So we're not looking at sustainability, but this is one that's really in regards to doing the right thing for our community and making some pretty good partnerships looking forward. As Erin mentioned, we are part of a broader network of hospitals and organizations. And the John Deere Foundation had approached our partners at the Quad Cities, which is in the Davenport, Iowa area, about what they could do in the communities to respond to COVID, particularly with the minority populations that have been disproportionately affected. So what we did is we took a look at what kind of things we could put together in response to this and put together a project and a proposal to the foundation and that they funded. And what we are doing is we are putting out COVID care packages to our community. And in the Quad Cities area, in the Des Moines area, we're doing 1,000 of these that are going out to members of our community that have been impacted by this. And this includes some personal protection equipment and cleaning supplies, as well as health education material regarding COVID, influenza, and how to seek care and how to take care of yourself. One of the things we did with this is we knew that we would need boots on the ground to do this. And we needed to be timely with this. And instead of utilizing money to do this with our own employees and trying to develop some sort of delivery system into these communities that many of our employees may not have experience, we partnered with another organization within our community called Every Step. And Every Step is basically a visiting nurse association that already has conduits into the community working with minority populations. They have all of the needs there, and they were also suffering from some of the needs in regards to funding for their employees too. So we did contract with them to help us get these out. Our organization has worked to get the supplies, put them together, and gotten them out to the community through Every Step. The first 500 went out earlier this midsummer, and very appreciative recipients. It's done we've gotten some great feedback in regards to this. The second 500 of these just were given to Every Step as of Friday, and they are currently going out to the community right now in kind of a timely manner to help really address the second wave, the third wave. I can't remember which peak they think we are in right now, but obviously, the COVID crisis has not gone away, so it's still a relevant thing that we need to pay attention to. I think what's important about a project like this is while it is a one-time thing, I think it does build a good relationship with someone like the John Deere Foundation on how we can mobilize and utilize their funding, in a responsible way to meet community needs, and we can be a reliable partner. We are looking at how we're going to measure this in terms of effectiveness, and we will provide that back to them, even though they haven't required that of us. But I think it's something that's important to close that feedback loop, kind of leaving the door open for in the future if we want to go back to them and talk to them about some interesting projects we might have. We've kind of established ourselves as an organization that can, meet their needs. So that's one of the projects that we've got going on right now, and we've been pretty excited about it. And I'll let Erin talk a little bit more about some other things that we've got going on.
So next slide, please. We'll transition over to workforce support and some of the grants we've received from there. One of our partnerships was with Iowa Workforce Development, and this was from some federal money passed down through the state, the U.S. Department of Labor. And it was really targeting high demand jobs with high turnover for our organization. So we were able to build some apprenticeship programs within our organization, specifically for CMAs, certified medical assistants, patient care technicians, plant operation engineers, and we're now getting into the medical lab technicians. And through that support, you can see the levels of funding we were able to receive through that partnership. The third one listed there, the $13,360, as Andrea mentioned, CARES money. This is actually in direct response to some CARES opportunities that came down through the state, really targeting people who had been negatively impacted in the workforce as a result of COVID. And so we were able to use some of that funding to apply towards some of our apprenticeship programs as they go into next year. What's not listed on this slide, but I definitely want to mention, is we also had a partnership with Central Iowa Works, and I know Amy Myers is on the call. She's the coordinator of that program, and we had funding through this through the end of this year, and it really was targeting support to those who have barriers to employment, including funding for tuition, books, supplies, and testing. And through that program, we were able to impact not just Unity Point, but the program in Central Iowa, 500 individuals in the healthcare sector. And of note, 70% of those were of minority population. And so that was another wonderful partnership with local organizations, really trying to build the workforce here in Des Moines. For those of you that don't know Iowa, we will need 5,000 more nurses by 2026. So there is a strong emphasis on building the nurse pool and the pipeline. And so these, through our apprenticeships and through programs like this with Central Iowa Works, this is a great way to build that. And we're grateful to have community support and funder support to build that for us. So next slide.
So we just wanted to talk a little bit about some of the future opportunities we see, kind of in the broader context, as well as a few specific opportunities we're seeing. One of the things right now is there's strong private funder interest in diversity, equity, and inclusion. Specifically here in Des Moines, one of the things we've seen is, obviously, I talked a little bit about the John Deere Foundation was looking at some opportunities that they were interested in pursuing. Bank of America has reached out also to our system, and I'll talk a little bit about that in just a second. But also, like the Northwest Foundation out of the Twin Cities, just funded a pretty big initiative here around, it's called One Economy, really looking at the African American population and what impacts their lives. And it really does get to employment, health, as well as income and housing. So, there's a lot of interest that's right there, that's available right now. Also, there's a continued focus on workforce with some of the government programs. Aaron has talked a little bit about that. We know there's some with the CARES Act. There's some others that are at state levels that are available, and Aaron talked a little bit about that. One of the things we find that's important is some flexibility, for new opportunities and adaptability to align with funder goals. And kind of what we're meaning about that is, kind of have some things ready. Think about if you could do something and funding dropped in your lap, what would that be? And I think a good place to do that is to really go back to your community health needs assessment. What kind of things were identified as priorities that maybe you've put on as a wish list of what we might be able to do? And so those are some opportunities you might have. And that just kind of ramps up things a little bit more quickly. A couple other things that are really tangible and in the works right now, as I mentioned, a Bank of America grant that is in the works. That was, again, with our Quad Cities partners and throughout our whole system. And that would be a 4-year project that would start with, starting with influenza vaccinations, and then lead into really a lot of health education, particularly around vaccinations and any of the misinformation and things like that, to really help with addressing the minority community's concerns about that. And then it's really starting to tie into some other work we're looking at about especially getting the African American population more embedded within medical homes is one of the things that also aligns with some other work that's going on here in our community. So if that comes through, that'll be a pretty significant body of work for us around this COVID. We'll have to mobilize a lot of workforce, obviously, to go out and do some of that work and probably expand some of the training. One of the other things that we've got going on is our community health workers. And I know that this is pretty prevalent across the country, but we work with a partner called the Iowa Chronic Care Consortium that's developed the Community Health Worker Alliance. And it's an apprenticeship program. And we are part of that demonstration project and have received some funding in part to help hire a couple community health workers who have obviously had to shift a lot of their focus recently to dealing with COVID, dealing with patients who have to have their social needs as a result met. And then something just kind of along the lines with this same group I just learned about the other day is they've developed what's called a Community Health Navigator training. And it's kind of in response to COVID. and providing additional health navigation training to healthcare workers in regards to how to work with people in terms of addressing social determinants of health and other types of that needs that aren't as medical, but to provide them with just some extra skill sets for their own need and dealing with their work. So I'll let Erin bring things on home for us here.
Okay, last slide, please. We wanted to have some key takeaway action items for you. Hopefully you found it informational. For us, utilize trained resources available to you. So if you're within a large organization or healthcare system like us, there's multiple committees, departments that we can partner with, such as like community engagement committees, employee engagement committees, marketing department. Just really familiarize yourself with the resources within your organization that you can partner with that might make sense to accomplish your goals. Obviously, engage your foundation and grant staff. Andrea spoke to that. We can't fundraise for you if we don't know what you need. And so it's so important I'm a fundraiser like Andrea. So I can't go out there looking for grants if I don't know what our organization needs or what our vision is. And so it's important to have those strong relationships within your organization. Andrea briefly mentioned on this, sign up for notifications. I read all those grant email RFPs that come through because I never know where the next opportunity might come from. Yeah, my email inbox is flooded each day, but we find great opportunities through those notifications. So if you have a chance to sign up for some that make sense for your departments, do that and have a vision. Like Chris said, if funding magically falls in your lap, what would you do with it? Have some ideas kind of rolling around. You may not have it fully fleshed out, how it will work, but if you have some ideas and vision, that's a great starting point for opportunities and for foundation team to really find funding. And that kind of wraps it up. Unless, Chris, you have anything else to add?
No, I think the only thing is I'd hammer back, if you have grant writers and grant staff that are available to you, partner with them. I hate writing grants. I like to identify need and opportunity. I have written grants. It's not my forte. So I will always look for the partners within our organization that can help me with those things and make my life easier.
Great, thank you so much for that. We can go to the next slide, and I'm going to turn it over to Shannon, who's going to have some great things for you to share. I really appreciate that. What you all shared in Des Moines around, your ability to be able to leverage your partnerships, to really be able to meet community need. And Shannon has more of that to share as well. So I will turn it over to her.
Hi, thank you so much for inviting us to be able to participate with you guys. So yes, we're going to talk a little bit about preparing the workforce for tomorrow. I love what my colleagues in Des Moines had to offer because a lot of what we do is the same. We rely on public as well as private opportunities for funding for workforce development pieces at Asha Health as well. Next slide, please. So just a little bit about Asha Health. Asha is the largest not-for-profit health system here in Louisiana. We have facilities throughout the state, as we hear in good Louisiana say, from the top of the boot to the bottom of the boot. We have 100+ health centers that are engaged in our communities and about 14 urgent care centers and growing rapidly. Our staff, our team, our employees are absolutely engaged in our community in many efforts, one of which is workforce development that I'd love to be able to share a little bit with you right now. So next slide, please. So this is a little bit about what our pipeline model looks like for workforce development. We are excited to be able to have a couple of different opportunities as it relates to bringing in externals as well as internal engagement. Our internal and externals are absolutely engaged to our workforce development piece, but also we have the opportunity to have a career center as well, which enables us to be able to contact and get involved in where folks want to go as it relates to their career paths and workforce development. What we will do is we bring individuals in, we perform assessments understand where they are as it relates to comprehension, literacy, and the like. Identify what might need them to be, what need they may have to really be able to move forward. That might entail university settings. That may entail our community colleges or certification programs. We then work to make sure that all those pieces come together so that we enable them to be able to reach the goal that they're looking for, whether it be an allied health or whether it be something that has more professional skills associated with it. Next slide, please. Our collaborative engagement. This is what has worked well for us with workforce development. We engage with several different types of partnerships. I mentioned previously public and private partnerships. We have relied on leveraging our relationships with Workforce Innovation and Opportunity Act folks. Those are going to be your job centers, your American job centers. We have absolutely been able to get funding to build programming as well as to enhance and grow programming that has already been existing. And I'll talk a little bit more in detail on the next couple of slides about how we've done that. We also rely on philanthropic donors as well. We've worked with Kellogg, Capital One, Entergy is an energy company here in the Gulf South that we've worked closely with as well as economic development arms within our state. We've worked with the Greater New Orleans Foundation, Geno Inc. These are opportunities that are absolutely leverageable in that everyone is concerned about building greater and stronger communities. And it all starts with opportunity. So we're all on the same page. It makes sense for us to come together, have the conversations, and develop planning and programming to be able to get there. Next slide, please. So part of what we did during COVID was our patient care technician training. This was an accelerated program that we were able to develop and run during the height of our COVID event. This happened beginning of, probably towards the beginning of May, moving through July. We were able to get through 2 cohorts. I'm sorry, it's April actually. I did not realize it had been that far out. So we were able to get 2 cohorts through our rapid program. We were able to graduate more than 40 individuals, and these folks were coming from hospitality. Here in our area, we are very dependent on hospitality. New Orleans is absolutely the place to visit. During COVID, though, there were absolutely challenges with that. What did that mean for us? That meant, how do we figure out how to, one, meet our need as a health institution, but also what do we do in helping our community as well? Some of you might know how hospitality skill set absolutely is transferable as it relates to being able to take that customer service piece of it, to be able to work with patients, help them in the hospitals, help them to be able to navigate and just work through just basic needs. We knew that that was an opportunity for us. We partnered with a local institution, New Orleans Career Center, which is absolutely a great advantage for us in that they were able to provide a 100% virtual opportunity. We were able to do the on-the-job training the first week that folks were hired into the organization. So you came into a place where you were able to now have an opportunity to get a virtual education, receive a industry-based credential, and actually have it end in work. And this took only 5 weeks for them to be able to do that. So folks went from being unemployed with some having little or no exposure to any type of skill set training to now having the ability to have an industry-based credential and enter into healthcare, not ever having thought that that was an opportunity for them. And we have had a significant retention rate with these individuals. Now, the funding for this particular program was given to us through a philanthropic donor. It was a remarkable opportunity for us to really bring in folks who needed an opportunity, and we absolutely needed the assistance within the workplace as well. Next slide, please.
Shannon, we did have a quick question before we get too far along, and they were just curious whether you certified them as PCTs or CNAs through that program.
Yeah, the first two programs, they were certified as patient care technicians. We're now running another program where they will also receive their CNA. In Louisiana, as with many other states, because of COVID, there were challenges in CNAs being able to get that hands-on experience, that skilled nursing experience. So we know that we have a challenge in making sure that our patient care technicians are able to work in any area that we would need them. So we're now at a place where those stipulations have relaxed a little bit, and we're able to now get that CNA training. And we've partnered with other pieces within our organization as well as external to our organization that can help us in providing that skilled nursing piece as well. But I will tell you, those individuals who were certified as patient care technicians minus the CNA, they are absolutely able to work effectively and efficiently within the organization. Of course, there might be one or two different areas where they may not be able to work because they lack the CNA, but the other pieces that they have gained in terms of education and skill set are being utilized very much so within the organization today.
Thank
I
you.
hope that answers that.
Yes, that was great. And then we've had another question come in related. So I'm going to ask it now. And it said, in regard to PCT, what would be the entry level salary? And are these full-time positions with benefits?
They are full-time positions and they do have full fringe benefits. These are actual FTEs within the organization. And Asha has a minimum wage of $12 an hour. So no one will enter into the organization entry level making less than $12 an hour. But I will say within the PCT piece, it does also give you an opportunity to move on a pathway. We are currently developing programming that will move patient care technicians into other pieces. That may include medical assistant if they want something that's more of a lateral change. It may also include going into an LPN position. We have an accelerated LPN registered apprenticeship. We're also building out other pieces that will allow patient care technicians to be able to move into other settings. Some of those are clinical, some of those end up being something more related to community health worker, being related to a clinical research coordinator. Having that previous medical terminology, also having the opportunity to have engaged with patients in a front-facing manner gives us the opportunity to leverage that skill set and build upon it. Part of what we hope to accomplish over the next 5 years is to ensure that we're bringing frontline folks farther into the organization where they have pathways that reflect their needs, our needs as well, and the needs of the community. So it gives a great opportunity for patient care technicians to enter into our system. So I'd also like to talk just a little bit about some of the programs and how it offers us an opportunity to increase diversity within our organization. By working with workforce innovation, working with our American Job Centers, we're able to cast a large net when we do that. It means that we're now able to look and talk to all members of our community, no matter what their backgrounds are. We're not limited in a certain segment. So it does help us to increase our diversity within the organization as we build workforce development pieces. It also allows us to be able to provide supported services to decrease barriers to employment as well. We build a social worker into each one of our training programs. We all can agree that life happens sometimes. It might be childcare, it may be transportation, it may be housing. Those are things that can get in the way of you obtaining employment as well as maintaining that employment. So we've built measures in to help help mitigate that as much as possible so that folks can learn to navigate those challenges and truly be set up for success. And it also helps us to create an environment where we know we're providing an individual with a leg up. You don't have the debt when you come through one of these workforce development programs. You can go to other training programs on your own, and you may end up having to take out student loans, or you borrow money from friends, family, whatever the situation may be. These particular programs will enable you to obtain an industry-based credential, in some instances even obtain an associate's degree, depending on the program that we're putting you through, and you literally walk away with no debt. It's an opportunity for a person to start a career in a way that they feel as though they've got a long runway. And we believe that it encourages hope. It enables us to be able to help instill that in our community members and the folks that we work with, and just overall allowing folks to realize that there's some things that they are able to do that they thought they would not be able to. And it all begins with the dignity of work and obtaining the skill set. So we're excited about how workforce development efforts are playing into that. Next slide, please. Our last focus is about building healthier communities. As I just talked about, how we're able to work with folks to enable them to become gainfully and sustainably employed. Again, we can all recognize that that has a strong effect on our communities. Folks who are able to produce income to help their families, of course, are able to get better health care, better chances to eat right, exercise, and to do those things that are going to affect our community as a whole. So we recognize also that workforce development is absolutely a catalyst for many other opportunities for folks. It also helps us to understand that by bringing in individuals to work in these areas, especially as we talked about the patient care technicians and folks who did not realize they could enter into healthcare, they also have an effect on their own communities. They're seeing what happens every day with patients, so they're able to take that information back to folks who they share life with and help increase their awareness as it relates to healthy living and best practices and things of that nature. And just, again, instilling an opportunity for folks to be able to live gainful, sustainable lives. So those are the tactics that we're using currently in attacking workforce and ensuring that we're working with our philanthropic donors to institute programming that will affect our communities as a whole, as well as partnering with others, nonprofits, public pieces, and we're also doing cross-industry partnerships as well. We work with other healthcare institutions. If there is a strong need within our area for a certain position, we will absolutely work with other healthcare systems to be able to ensure that we're leveraging all resources available to train and educate and place folks in viable employment. So I think that was my last slide. I'm not sure, but I think it was. If you guys have any more questions, I'm absolutely excited about being able to answer them for you.
Thank you so much, Shannon. Yes, if we could go to the next slide, we will see that it is question time. So perfect. If folks have questions, you can put them in the chat or the Q&A. I will start us off with just, I think it's implicit in some of what you said, but I'd like us to get a little explicit about the fact that sometimes funders, philanthropic funders, are hesitant or unsure about funding employers, right? Like you're a for-profit organization. Why do you need my money? And so I'm curious from folks on the panel, but also on the line as well, if there are some strategies that you've used to kind of work around that hesitancy, or what has been successful for you to have funders who are concerned about that, but willing to and be able to secure those funds. No?
Well, let me take a stab at that, and I don't know if I'm on the right train of thought. I think one of the things we always like to go back to in regards to justifying what our requests are and our actions are our community health needs assessments. And in our most recent community health needs assessment, there was a great deal about workforce, and specifically the workforce representing the communities better, and what, the makeup of our communities were. So, I think that that's one of our justifications in that, we really try to stress that our community health needs assessment isn't just done for the hospital, but this information and these, the input is solicited from the broader community. And it's a roadmap for our entire community, not just the hospital. So I find that's one of the ways I think whenever I know that I'm trying to make a case for any kind of funding or support for something, I go back to the needs assessment and tie it back to that. And like I said, our last one has made it very easy, especially in regards to addressing healthcare access as well as employment.
Yes, great. So what I heard there was, the ability to tie it both to larger goals that coincide and align with your organization and with community goals beyond that. Another area where I've heard that folks have been successful is really around the innovation, right? Coming in to a funder to say, we want to try something new here. Can you help us get it off of the ground? And being able to bring some innovation to a longstanding problem or a new idea to bring to the table can often be a compelling reason to get some of that funding. And have any of you utilized partnerships in that way, whether it be to access funding regardless, right? How have you leveraged some partnerships?
Well, again, I'm the community guy here, so I can say a few years ago, we got a Build Health Challenge grant here in the Des Moines area, and many people are probably familiar with that. And it was a little bit innovative in that what we were doing is we were addressing pediatric asthma by going out and doing mitigation in the homes and education in the homes. So we partnered with our local public health. We partnered with our housing authority on this, and we partnered with Every Step and a few other community partners to get this grant. And it was a 3-year project, and we would identify these kids coming into our ED and then make referrals so that they could get the education they needed for better environments and to do housing mitigation if they found that something was needed. So it was a big and broad type of project in which we got some community partners engaged in that.
Great. So we do have one question coming through. And it is around the medical assistant apprenticeships. And so folks were curious what have been the successes and barriers to setting up that apprenticeship. And let me know if you guys feel comfortable with being able to answer that, because I don't think you guys do the program implementation. So if it's a little outside of your depth, then I don't know if Shannon can contribute to that as well.
Absolutely. So we do have, a medical assistant to LPN registered apprenticeship. But we also have a program prior to that that's called the MA Now program. With MA Now, it is a 6-month accelerated medical assistant training. With that, individuals receive a CCMA, the Certified Clinical Medical Assistant. They also will receive EKG, BLS, and phlebotomy. And in our coming program, a CNA as well. So you're actually leaving with 5 industry-based credentials. The importance in that was absolutely reaffirmed for us during the COVID event. We were in a situation where medical assistants, we were graduating actually 3 medical assistant classes. Those folks were pegged to go to work in the clinics as MAs. And I'd seen a question earlier, do PCTs and CNAs come in at the same level? So it's a little bit different for our organization. CNAs and patient care technicians are in our hospitals, while medical assistants are traditionally in our clinics. By cross-training those medical assistants, we were then able to take them and place them in places that were needed during the COVID event. They weren't able to go into the clinic, but now they were able to be phlebotomists and work in the labs. They were able to be patient care technicians and work on the floors in the hospitals as well. So that particular program allows us to customize it in a way that these individuals walk away with several IBCs along with cultural adaptation as well. And we begin onboarding from day one. From the first day that they're in the training program, they're not only learning skill set didactic, but they're also learning cultural pieces for the organization, as well as pieces that reflect around conflict resolution, ethics in the workplace, and other essential skills that can help them on the job as well as personally. So that program works really well for us also as a backfill into our MA to LPN registered apprenticeship, which is another accelerated program. These individuals who were medical assistants for at least 20 months within our organization are now able to move into an opportunity where they become licensed nurses within 13 months of training, additional training. So it sets up a pathway, and we will be moving those LPNs into an RN bridge. So it all flows together as an absolute pathway in achieving what we need to be achieved.
Great, thank you. And so forgive me if you addressed this in that statement as I was doing multiple things, but they were curious, were you guys doing the training in-house or partnering with community college or hybrid?
So we partner with community colleges. LCTCS is our system here, Louisiana Community Technical College System. We will partner with them to get those particular pieces, but I will tell you, we also partner with other educational opportunity folks as well. We've partnered with MedCerts on a pharmacy tech piece. It just really depends on what the need is for the organization, as well as the ability to customize those trainings, which is essential for what we do all the time, is customization. So it varies, but with the medical assistant and the LPN piece, yes, we have worked with our community college and have a very strong relationship with them throughout the state.
Great, thank you. Josh, could we go to the next slide, please? So we have just a little reflection that, if you've attended these previously, you guys recognize me trying to just pull out what was good about this for you all. So if there was one thing that you heard today that resonated with you or sparked a new idea, I would love you to throw it into the chat while we do a round of thank you and gratitude for our presenters today, for all of them showing up and sharing their innovation and what they're doing on the ground. We really appreciate the time and energy that they took to be able to come here today. And then I will also share gratitude, because there can never be too much gratitude in this world at this moment, for all of you participants coming to show up when you have so many things on your plate, and being here and being attentive. I appreciate you all very much. So thank you for the input in the chat. This is great to see that there was some great comments around the slides and being able to see the training models. So there was good stuff and people were taking away from here. And then we just have one, now that we just have 1 second here, we had one additional question coming in. Well, you know what? I think it might be too much to fit into 2 minutes, frankly, and I'm sorry for that. But what we do know here is that there's a lot of interest in apprenticeship and people hearing more about that. So I will certainly take that into consideration as we think about more opportunities to engage our peers across the nation through the CareerSTAT network. So thank you all so very much. I'm going to give you back this 30 minutes, this 30 seconds. We have a reminder here around our next webinar in November, and that is going to be introducing the National Fund's Financial Wellness Guide to help employers to help their employees. So please save the date for that. We will see you on November 18th. And until then, thank you all so much and have a wonderful afternoon.
Thanks for having us.
Thank you.